Hi, it's Mike Petoskey with CMD Wellness. Today we're continuing on our series on what is first aid according to OSHA. In subsection D of 1904.7, OSHA highlights that using wound coverings such as bandages, band-aids, gauze pads, etc., or using butterfly bandages or steri strips are considered to be first aid. So this is where we have a lot of questions between safety and medical. Medical providers that are not familiar with occupational medicine struggle with this too. So Dermabond very frequently comes up with this as skin glue, and some people have made the argument that there are over-the-counter skin adhesive glues. OSHA did send out a letter of interpretation that specifies that any kind of skin glue is used for wound closure and therefore would be considered medical treatment. There is one other type of over-the-counter device that is very commonly used, and this is called a ZipStitch. ZipStitch is similar in regards to a Tegaderm patch and also has plastic ratcheting zip tie function to it. The way this device works is that you have the wound in the middle, you overlay the two sticky parts of the ZipStitch, and then you use the little ratcheting straps to tension and pull the two sticky portions together, which would approximating the edge of the wound. OSHA also very specifically said that number one, this is a wound closure device, so it does fall under the medical treatment. And also they reiterated in that letter of interpretation that if it's not on the OSHA first aid list explicitly and specifically, you have to default and consider that it is medical treatment. There is one other route to help bring the edges of a wound closer together that don't require any extra equipment at all, where if somebody has long hair and they have a scalp laceration, you can actually use the hair of the scalp and tie knots in the hair and bring those two edges of the scalp together. I have not been able to do this in a occupational medicine setting, and I'll tell you why. Number one, it requires the laceration has to be in the scalp, and most folks working in an occupational or industrial setting are wearing hard hats, and so we don't get a lot of scalp lacerations. We'll get a few, but not a lot. And number two, most of the workers that we're dealing with in occupational industrial settings are male, and most of them don't have very long hair. So since we don't have this type of injury very commonly in the occupational setting, a scalp laceration, and then we don't have very many patients that have a scalp laceration who have long hair, this doesn't tend to work out very often either. But I've seen that done in the emergency department with scalp lacerations, and sometimes you can actually help the scalp lacerations heal up without using any kind of anesthetic, without using any kind of sutures or staples or any other kind of device. So if this tip helped you and you're interested in learning some more, please follow us on cmdwellness.com.